Hey, it's Andrea. Happy New Year. I made it through Christmas. It wasn't easy. I don't think I took it very well. I don't know why, but it was a hard year. And even though I enjoyed the holidays are very stressful, especially for people with bipolar disorder or anxiety or any, even just COVID, I think nowadays. So I had a meltdown, which I did a little report on, and I did a little follow up saying I was okay. And in the meantime, I've been kind of adjusting my meds, and that sucks. But I'm doing okay. So I want to give a shout out to my friend Samina's Scepter new Power Glass lip gloss. This is the note. The name is, hold on, I'm looking, Sharada, and it's a moisturizing lip gloss. So she's my friend. She's been helping support me with my book, Bipolar Phoenix, and you can buy the book. Let me get it on here. You can buy the book at Amazon or Kindle. And sometimes there's some price deals, so look out for that, but appreciate your support and buy the book. Yay. Okay. So I have a really special guest today. This is a lady that I met through the yoga community, and turns out we are both have bipolar disorder. And she's been through a lot. She'll talk a little bit about it. She's super brave. She's from Singapore. And I'm just really, really excited to talk with her today because she's had so much experience with the illness and with treatment. And I think there's some interesting things that she can share about treatment and about also stigma, because she does a lot in Singapore and on social media about managing stigma, battling stigma, dealing with stigma, identifying stigma. I think she's really on top of this, and she has, some great media acumen as well. So I'm going to bring on my friend Lishan Lim. Hey.
Hi, hello.
How you doing? Thanks so much for coming on Bipolar Phoenix, Andrea. As you know, it's part of my book promotion. I hope you get a chance to review my book sometime. I should get you a copy. How are you?
Hello. Oh, I actually can't hear you. Can you hear me?
Oh, you
Can
can't
you
hear
can
me? I
you hear
can hear
me?
you. Can you hear me now?
Okay, I'm gonna rejoin. Okay.
Okay. All right. Let's try it. Oh, technology. So we could hear each other before. I don't know what happened, but let's try it again. And yeah, in the meantime, let me just kind of update. So I started a couple of new meds, and that's always really precarious, like it changes things and you don't feel right. And I took taking a new one called Cymbalta. And I'll tell you a little bit more about that later, but you may have seen Cymbalta on TV commercials, at least in the United States. Okay, can you hear me now?
Yes, I can. I can.
Okay, wonderful, wonderful. Lishan, tell everyone about yourself.
Hello. I'm Lishan. I got to know Andrea because we're both yoga teachers. Yes, and Andrea teaches kids yoga and also pre-postnatal yoga.
Mhm.
So that's what I was very interested in after I did my basic 200-hour teacher course. Yeah. So for me, I've been teaching yoga freelance for the past 6 years, and I've taken a break since the circuit break in Singapore since May last year. Yeah, to
Mhm.
focus on my recovery.
Yeah, well, you know, as you know, I understand. I mean, Lishan and I run into each other at the hospital when we go to take care of ourselves, where we go to the doctor and all that. So like, we're on the same path, and we just, sometimes we talk and we have Lishan, sometimes we catch each other at a weird time or the right time, actually, where we need to talk to someone who gets it. Like my medication changed. Like I texted you right away and I'm like, this is really hard. And you're like, yeah, even if it's that, it's an understanding there. But certainly you have your own experience with bipolar disorder. And can you talk a little bit about, how do you handle it, and how did it come about in your life, and how do you handle it? I think people really want to know, what do you do?
Yeah, I think for me, from a young age, I've always had like I always kept things to myself, and I tend to um, I've been through a lot of stress through the Singapore education system. Yeah,
Yeah.
so crying to myself and all that is very common for me. And then when I was about 15, I started having my eating disorder. So I always thought it was depression. So about 2.5 years ago, my ex-boyfriend recommended that I see a psychiatrist. So I was like, okay, sure. I'll just check it out. I'm like scared, but okay. So it took actually 5 weeks for me to get the next appointment, like the next available slot. Even though it was private.
Right.
Yeah. Yeah, because I chose the psychiatrist based on her specialty because she specializes in eating disorders and mood
Ah.
disorders. Yeah, so I wanted to get someone who knew what she was treating.
And that was kind of the more immediate issue, wasn't it? And if you don't mind me saying, I know, well, Lishan's been in the media and is an actress and a model. And so there's a lot of pressure there as well. I hope you don't mind me mentioning that. I love telling people that you're in government films and stuff, which is cool. I know, well, I'm really proud of you. But so the immediate thing was the eating disorder, and then bipolar emerged from that, or was it like a symptom of bipolar, do you think?
Yeah, I think it's a symptom of bipolar. Because I wasn't in the media industry yet when I was 15.
Oh, okay.
I only started when I was maybe 23, 24.
Mm.
Yeah, so I really had like low self-esteem and body image issues since I was a teenager.
Mhm.
Yeah, I guess, some people like we just base our worth more on our looks. Yeah, and also, I think I've already had bipolar since a young age. It's
Yeah.
just that when I started taking antidepressants like Prozac, so it instead of taking a mood up to a baseline, it brought it beyond the baseline, so I became manic.
Oh, yeah. That was always a risk with, so antidepressants, if you're on, most of them can trigger manic episodes if you're bipolar. And a lot of times we don't find out we're bipolar until we're on antidepressants, and then we're, like that's what happened with me as well. Similar, I had a little bit of eating disorder issues. I'm as an athlete, and my weight still to this day, but has been an issue. Not eating disorders, but I had experience with that in college. And then everyone was putting us on antidepressants. I'm a little older than you, but they were still like, oh, it's anxiety, depression, and those are great meds. But how do we know that we're bipolar until shit hits the fan? So how did you find out?
Oh yeah,
What happened with the meds that gave them the indication?
So fluoxetine, which is Prozac, is supposedly good for both like bulimia and depression. So after I took it for about 2 months, then I started having symptoms like my heart rate would be quite fast, and then I had like this kind of weird kind of energy, like more hyper kind of energy. Yeah. And then my ex-boyfriend was like, I think you have bipolar. It's not like depression, because his mom has bipolar.
Yeah, so he had some experience.
Yeah, so after that, then my psychiatrist changed my diagnosis from dysthymia to bipolar.
Oh, okay. And then did you start getting treated for specifically like with mood stabilizers? See, for people who don't know, that's the difference between depression and manic and bipolar disorder, is that we need a mood stabilizer to keep from going up and down. So that's the difference. We can still take an antidepressant, but most of the time we need to bring it down. So Lishan, did you then start, now you've been on a bunch of different meds. So did you then start mood stabilizers? And tell us how you were treated, and I would like to get further down to the most recent treatments.
So after that, I started taking antipsychotics, so like quetiapine, Abilify, Latuda, which are very expensive, especially the last.
Yes, they are. Yeah.
And they gave me like very undesirable side effects, like having like akathisia on Abilify was really bad, which is like tremors, and then this very uncomfortable feeling of like you just want to crawl out of your skin. Yeah, so it was very difficult while I was teaching yoga, because some parts were like, okay, let's breathe and all that, and then I just felt that I just couldn't sit there, and I had to like keep walking around the class to like, yeah.
Yeah, I totally understand that. I mean, I had to put on a show a lot as well. It was good for me, but it wasn't. I definitely felt bad some days. But so you had a bunch of meds that didn't work. Now this happens where the meds don't work. So how frustrated did you get with the problems that you had with meds? I know you and I've talked over the years, and I know it's been hard. So tell me about how that's been.
Yeah. So after that, I did actually like a DNA test for medication. Yeah, which was about like like 400, 500 US dollars. Yeah. So they
Uh-huh.
send like a cheap swab and then
Yeah.
they bring it back. However, I don't think it's like really accurate because there's still like, they put it in like 3 categories. Like green is like the traffic, like green, and then yellow, and then like red is like no.
Oh God.
Yeah, there's not so many options to go through. So, because seeing a private psychiatrist was getting really expensive.
Right. I
Yeah,
remember. Yeah.
yeah, both psychiatrists, psychologists, and medication. It's a lot of money. So I started seeking help at NUH, like National University Hospital. Yeah, so
Right.
I got about like a 50% subsidy. Yeah. And
Okay.
from there, I started on mood stabilizers, so lamotrigine and now topiramate. Yeah.
Yeah, I'm on that lamotrigine, Lamictal. Yeah,
Mhm.
and that's Lamictal. In fact, is also an anti convulsant. So, like, if you have
Mhm.
epilepsy, you might also be on that medication. So, fun fact. But Lishan, you've done some interesting new treatments,
Yeah.
and the first one I want to ask you about is transcranial magnetic stimulation. What
Yes,
is
yes.
it? What is it, and how did it go for you?
Yeah, it's very interesting. So, usually if medications don't work for some people, then uh, psychiatrists would recommend either ECT or TMS. So ECT is electroconvulsive therapy, and then
Yeah.
TMS is transcranial magnetic stimulation, which you just talked about. So the latter is actually using like MRI strength waves to target like certain region of your brain, which the psychiatrist would decide. Yeah, so it would be very different depending on you. Yeah, and then he would adjust accordingly. Yeah, so maybe he'll meet you every week or every 2 weeks, and then kind of see how it goes. Yeah.
And,
So for
and,
mine,
and
it's the left prefrontal cortex, and it's the
yeah,
flat.
yeah. That's
Yeah. So supposedly, like the
that's
left
where
side's a lot
bipolar
more.
resides, apparently. Yeah, that's where the bipolar resides, is in that prefrontal left side. Exactly.
Mhm.
Oh, I'm so glad
Mhm.
I knew that. So how did it feel? Was it weird, or did you feel the stim? I've done stim machines for insomnia. Like they're just little
Oh,
stim, like you would do for muscle stuff. Very similar. I put it here. It looks totally whack, but it's like
oh,
I wear a
what?
headband. I look like a
Uh-huh.
70s tennis player, and it's insomnia, depression, anxiety. I'll show you a picture sometime. It's funny, but
Okay.
it
But
terrifies
how
it
does it work
terrifies
though?
people.
Like,
It
what
terrifies
kind of
people.
mechanism?
What's that?
But what kind of like mechanism is it, and
It's
how
a wet,
long?
it's a wet sponge, like an electric chair, like they used to do, like a wet sponge, like the Green Mile. I don't know if
Oh,
you know
okay.
that movie, but I could feel the stim, but it showed like flashes of lights on the sides. Well, what does it feel like to have that TMS? Did it feel like
Mhm.
anything, or was it just relaxing, or what was it like?
So at first, like it would feel like a little painful or intense, but after every session, it kind of like, and then you
Oh,
can kind of
really?
like
Okay.
just relax because you're used to it, you're used to that discomfort. So it kind of feels like a rubber band snapping
Mhm.
at that region.
Oh, wow.
That's
Okay. That's kind
or
of
like a
weird.
woodpecker.
Did you
Yeah.
approach it like, I mean, I know you, and I'm thinking that maybe you approached it like, okay, this is going to help me, so I'm going to tolerate this.
Yeah.
Is that how you
Yeah.
felt? And
Yeah.
what was the result? Did it work?
Actually, I'm not sure whether it works. Okay, I feel like it does because my mood has been increasing, and now like based on the bipolar scale, like 5 is like normal baseline, and 0 is like extremely suicidal, and 10 is like loss of touch, like
Yeah.
mania.
Yeah.
So
Mhm.
I think it made me go up to like a 7, which is not so good, I feel, because it's kind of like a roller coaster ride, which you feel like you
Right.
can't get off. Yeah,
Right.
so I was like spending a lot of money in the past few months, but I think in the past week it's gotten better because we stopped the sessions. So we will like resume again when like my mood maybe goes to baseline or dips a bit.
Okay.
Yeah.
I had a question about that. Like, okay. Well, let's go to ECT. So ECT is the more one that people know about, but they think it's
Mhm.
like a Ramon song. Like it's like, oh my God, and it's got to be
Yeah.
painful, and like you get knocked out. Tell me, and I'm interested in ECT, and I've had people in my family have said, hey, maybe you should try ECT.
Yeah,
So I know
yeah.
there's some memory issues, but can you tell me what is it like to have it done?
Mm.
And then there is a little bit of side effect to that. Can you talk about after?
Yeah. Because for TMS, there's no side effect or very
Yeah.
minimal. Like for
Yeah.
me, I don't get any side effects from it or anything that affects me.
Mhm.
So ECT, I did 8 rounds of ECT. So 6
How long
were,
are the sessions?
oh, it's only half an hour or
Only.
less. Like the procedure is really short. Yeah.
Okay.
So you will go under like just a light general anesthetic.
Oh,
Yeah, so
okay.
that you don't feel anything, and then they would supposedly like induce a seizure in your brain.
All
It sounds
right.
scary, but it's not like, and I think
Yeah.
it's only for a few minutes, and then
Really.
after they'll just check like, okay, you're fine, and after you just wake up, and then you're fine,
Right.
and then you just have like breakfast. In fact, people do it as like a day procedure, like a day
Yes,
out.
that's what I understood as well.
Yeah.
Yeah. And then
Mhm.
I know there's memory loss. Do you experience that?
Um. So after
It
6
can be.
sessions, I think the reason why I did 6 bilateral, which is both sides of the brain, and then 2 unilateral. Yeah, because I was feeling like, oh no, like I feel like a bit hazy and then like getting forgetful. So I told the doctors um like how, like what am I gonna do? Then they're like, okay, we just do like on one side. Yeah.
Yeah, so that lessened it. Okay, that's interesting. And I keep forgetting my question of
That's
the
okay.
of how effective it was. So it wasn't
Mhm.
painful. You know, you get used to the discomfort when you think, okay, I'm going to help myself. Um, yeah. What are you doing now? Are you still doing either one or the other?
So ECT is just done like Monday, Wednesday, Fridays. Like you
Mhm.
can do it inpatient. You can just stay 1 to 3 weeks, however long you
Oh, really?
want.
You stay in for the treatment? Okay, I didn't know that.
Yeah, it's usually
I
done
wanted,
at least 6. So Monday, Wednesday, Friday, then Monday, Wednesday, Friday.
and you're in the hospital for that time. Wow, I thought it was like go
Yeah.
in, like you go to the dentist for a few hours, and I didn't know that. Okay.
You can do that. You can do that. But
Mhm.
it's just that that time I was feeling like suicidal, so they were like, okay, it's just better to like stay and do it. Yeah.
You're really good. You're really good at being honest and identifying that stuff because a lot of people don't say, "Oh, I'm suicidal." They're like, "I don't know what's wrong with me," and I think that I admire that about you as a bipolar person that you are able to see the signs and do something about it. And I know you're like me that you're an action person. You're like, "Okay, I'm going to try this. I'm going to try this therapy.
Mhm.
I'm going to go in when I need to go in to the hospital." And like I always think that's really cool. So you're not sure if you're going to continue or you're
It
thinking,
just depends on what the doctor says. Yeah. So
right?
because my mood is now on the manic side, so it kind of
Okay,
acts like an antidepressant as well.
yeah.
Yeah. Yeah, but
Well, I
the thing is that you can tailor it. So, but you want to taper it down or bring it up, and then you can like maybe go just once a week to maintain, or if you really need it, like I started with like daily sessions, like
yeah.
Monday to Friday, Monday to Friday, Monday to Friday, and then tapering to 3 times a week, and then 1 time a week, and then now my mood is going a little too high, then we're stopping the sessions, so
Interesting. Yeah. Well, I rev
yeah.
pretty high too, but this, as I was mentioning, this new medication, I usually am on. Normally, I would say I'm on a low dose of everything, which I
Mhm.
have been, but I've added a new 1.5 new meds,
Mhm.
and like I was feeling calmer, which we were talking about revving high, like
Yeah.
7 out of 10, 8 out of 10, and I normally like to feel that way. That's my sweet spot. That's my like get things done. I feel good. I can get all the things done I want to do, and then now I'm kind of like more. I suppose, like we chatted about this yesterday. I suppose more like
Yeah.
5, and like that's
I
normal.
think
Like
it's
that's normal.
good.
Like, I don't know
I
what I don't know what normal is. Like I don't. When
Yeah.
I argue less or worry less or get angry less, that's weird
Mm.
for me. And I'm trying to enjoy
Mm.
that. And that's where the medicine kicks in, is when you say, okay, I can manage my moods, I can see my moods, I can feel my moods, and now I know what I need, whether it's more meds, more ECT, less ECT. So I think people don't always know how do we treat it and how do we live with it. So
Yeah.
for yourself, with all of this, how do you manage, how do you live with it?
I think it's over the years having more self-awareness, like you said.
Yeah.
self-awareness and just being consistent with treatment, like wanting to get better. Yeah, I think these three things at least. So
Right.
motivation to get better because you're just tired of being depressed or like way too manic because it's just
Yeah.
not a good way to live.
Right. No, it's true. And I definitely, someone's ringing my doorbell. Rose? Getting deliveries since Christmas and all the late deliveries. Well, I think it's a really great point to say sticking with treatment, because people think, oh, I feel better, or I don't want to deal with this, or this is hard, or I mean, you've been through a lot with like getting the right treatment. So what do you have to say to people that maybe are also struggle with the meds not working, or they don't like it, or it's hard? I mean, you've really persevered. How did you persevere, and why did you persevere?
How? I think something that comes as a privilege, like financially.
Mm-hmm.
Yeah, I think that's something that not everybody has access to. Yeah,
It's
so
true.
maybe some people have to wait longer, like maybe 2 or 3 months to get a slot in the government hospital. It's kind of like the NHS in like
And
UK, right?
the US is like that too, although I've been very lucky. But
Yeah.
you know, at Chicago, I had a pretty good setup with the hospital down the street from my office. And then here I have private care. We have the same clinic. And I'm lucky that I have access, because I didn't always have access. And in my book, I talk about how I had a second job to pay for meds. Like that was my yoga. Yoga was,
No, I didn't know that.
15 hours a week or so, 18 hours, all just to pay, because my company stopped paying for the medication. They stopped paying. They're like, we're not paying for any maintenance meds. I'm like, so.
Yeah, because I feel like mental illness is something that it's something to be conscious of throughout your whole life, because there can be triggers, sometimes you think, oh, I'm recovered, but then, new things come up.
Yeah, Christmas came up and I blew my damn mind. So yeah, things come up. I wanted to talk a little bit about stigma, because you've been really active on social media, and Lishan does what I do. She talks about it. She's honest. She posts articles. I love the sisterhood there, because I always read her stuff. I mean, recently Lishan sent me a Simpsons memes on bipolar, which was really cool. So
that website is pretty good.
It was really good. And then, we always hope.
Right? I think it's the Mighty or something that they have like personal accounts.
Yeah. Have you done? Yeah, that's a good website too. Yeah. Well, talk to me about your goal with Stigma. What are you working on? What is your goal?
I think it's just the main misconceptions of mental illness, that people with mental illness are like weak, or like everyone has a mental illness.
That's a hard one.
Yeah,
that's a hard one.
especially these two. So like that we're not weak. We're so talented. Like, I meet so many people who are brilliant in the psych ward.
I know, right? Those are the stories I find people can't handle. I didn't talk about that a lot in my book, because people can. It's like a movie, like Beautiful Minds. It's like One Flew Over the Cuckoo's Nest. It's like whatever. It's a lot of that stuff's legit. Like there's someone in there who can recite an encyclopedia or like whatever, like, but can't handle emotions. So that's interesting. So yeah, and what are the ways that you address stigma? The way that you address, like, hey, this is what it's really like. It's not so bad.
Yeah, I think for me, like, social media is a way to do that, but not too much. So I try to like spread it around across.
No, it's hard, isn't it? Yeah.
Like maybe Facebook, or maybe through articles, or like just some of my posts whenever I post like photos or videos.
You do some very forthcoming things. Yeah.
Or being featured in some articles or videos and things like these, like little lives.
I know I've seen you featured in some Singapore press, which is awesome. Yeah. Hey, Lishan, we have a question, and I hope Hamza is still on. But let me see if I can show our question. She's asking, how can I know if I have bipolar or not? Well, I will answer first, and then I'll have you talk. You got to see a doctor. You got to see a doctor. Don't talk to Karens or essential oil people or even yoga teachers. Go to a medical doctor, any doctor, GP, OBGYN, endocrinologist, but psychiatrist, almost any doctor will put you in the right direction. So Lishan, what's your advice on that?
Yeah, I think for me is just to contact like a psychiatric clinic, like, you know, just go to the clinic, talk to the psychiatrist, maybe get therapy, you know, just to see whether you have the symptoms and see whether you get better on medication and therapy, how to address and cope. Yeah. I mean, it could be another mental illness, you know, because if you already think you have bipolar, maybe it is, maybe it's not, but, you know, I'm sure you're experiencing some symptoms of mental instability.
Yeah, and I think that's a really good point. And I've said this before, at least this year that I've been on the web talk show, is that COVID has created a lot of talk around mental illness because people who didn't have a mental illness are now feeling it. They're feeling what it's like to be trapped inside your head because they're trapped inside their house or whatever has changed in your life. So I think people are more open to it. And maybe it isn't bipolar. Maybe it's a temporary thing. I always say sometimes there's a temporary, you know, situation like a divorce or a death or losing a job or COVID. And you might not look, it's not a death sentence, only if you don't treat it. And it's not a life sentence that you can't handle. You can handle it with treatment. And I hope that everyone watching can understand that Lishan and I are very committed to our medical treatment, and we are yoga teachers, and we do other things like healing stuff, right?
Mm-hmm. Yeah.
I'm going to set it all there. Do you want to add to that?
Yeah, so maybe like specific triggers, you know, for people with like long-term mental issues. It kind of is very consistent throughout our lives. So I think that is something that, you know, sometimes it's not like just based on events, you know, just like having very normal days and then you're still having mania and depression, you know, like people will be like, hey, everything's good with you, you know, that you have so many things to be grateful for. Why are you still sad?
Mm-hmm. Well, I get that a lot. And when I had my little meltdown, a couple weeks ago, I did say that. I said, let me just say this right now. Like, paranoid feelings aside, I am not ungrateful. I have an illness that creates chemistry in my brain that makes me feel certain ways that are really not, you know, palatable for some people. Like, oh, you're so spoiled or whatever, you know, privileged. I wasn't always, you know, I mean, I've had some really hard times in my life. And that's why I wrote the book. You know, let me show my book again. But yeah, I mean, just because, it's hard for people to understand that. So thanks for bringing that up. One more thing. What one more thing do you want people to know about bipolar disorder? You've mentioned a few things already. So I'm just going to wrap us up.
Let me think.
Education and
maybe like famous people with bipolar.
You like that?
I don't know, because it kind of it's like, oh, maybe only certain kind of people are bipolar, and you know that thing about like, you know, people with mental illness are not intelligent, or they're like
that one kills me.
Off. Yeah.
Mm-hmm. Mm-hmm. I was really surprised to feel the feeling that people thought I was stupid, and I'm like, you know, I never thought that in my life. I never even questioned that, you know, except for maybe like serious math or whatever. But those are stigma issues that we're always having to deal with. Well, just final thoughts. You know, what's your best advice for people who are dealing with either bipolar or just generally mental illness? And what do you recommend aside from seeing the doctor?
I think
what attitude do you think people should have?
Yes. Aside from that, because, you know, when I was younger and I was like, no, maybe this will pass. It's just a phase, or like I'll just handle it by myself, or like maybe life is supposed to be that difficult, and everyone feels that way. Yeah, but it's not normal, you know. So there are a lot of resources online now, unlike the past. Like, you know, a lot of therapists have their own pages, like Facebook pages, Instagram site, or Pinterest. They have a lot of good resources, and also, I mean, the best would be still to get professional care, but also to maybe connect with maybe friends, you know, who are understanding or have empathy because they've also been through similar things. Yeah, so you
Girl,
don't feel
and you.
so alone in your struggles.
Mm-hmm. That's great. And I think I'm not alone is a really big theme that I work off of with one of my support groups. And you are not alone. And in writing my book, hopefully people realize they're not alone. Well, I've taken up double the time, but I knew that
No,
we'd.
it's okay.
You're so
Actually,
brave.
I thought it would be like 1 hour because
Oh,
maybe people check in and out of the live. So like
yeah, I'm learning. I'm learning. I think the shorter videos are easy to post, but I haven't figured out the editing yet. But maybe you can help me with that going forward.
or maybe
So
just post like the whole thing and then people will just like scroll.
yeah,
I
true.
don't know.
We're figuring it out. Well, Lishan, I want to say thanks so much for being so honest and super informative about the types of treatment that people don't know about, not just medication, but the TMS and ECT is really interesting for me to hear about
You
that
can just
too.
like Google TMS
Yeah.
and ECT, and I'm not sure there are a lot of like infographics about it.
Yeah, I hadn't looked into it, so I will now. Very good. Well, stay on the line, and I'm gonna close out the show, and thank you again for sharing everything with us today. Love you,
Most
girl.
welcome, and thank you those who are watching. Thank you for tuning in.
Thank you. Truth. I love it. She's so good at it. And I just really appreciate her, as I said, being really her candor, basically. I mean, not afraid. Can you feel that she's not afraid? Like, I'm not afraid to talk about it. She's not afraid to talk about it. This is where we need to be. And this is where we can help other people. So I hope that you found this informative. I hope that gives you or someone you know some hope that things can be managed and we can do this. And yeah, that's it. Please take a look at my book on Amazon or Kindle and appreciate any support there. And if you want to reach me as well, there's bipolarphoenix.com is my website. I took a little time off for the holidays and for the meltdown, so I'll be getting back into that with my newsletter. And you can sign up for my newsletter at the website. So thank you so much, everyone, for watching, and I'll see you next time.